among other initiatives that Veterans for America is very pleased to, that Mental Health America is engaged in, is the Operation Healthy Reunions, which again we believe helps to address a variety of different needs that have been created as our soldiers and other service members have been deployed. One data point, of the approximately 2 million people who have been deployed as part of the U.S. military to Iraq and Afghanistan, about 60% of those people have family members, either a spouse and or children. And the ripple effects on communities and service members is incredible. Veterans for America has been working on the Hill and encourages the mental health community to join us in an effort where we as advocates and we as citizens can take a more active role in ensuring that our service members are better cared for. There are a variety of different steps that many people in this room know quite well of the medical measures that should be taken, but then moving a step or so back in the process, there are other steps that can be taken by policymakers that we as citizens can push for that will decrease the load of the psychological burden, that will decrease the psychological burden created by conflict. To be specific, about a year ago, Congress debated, and in the case of the Senate, failed to pass a measure calling for active duty service members to have at least 1 year at home between deployments. For those who have been deployed a year, at least give them a year at home, again, because of the well-known effects of the negative effects of not giving service members that much time at home. For members of the Guard and Reserve, the provision called for them to be given 3 times as much time at home between deployments because members of the Guard and Reserve did not join with the expectation that they would be deployed multiple times over a few-year period. Unfortunately, in the U.S. Senate, this measure, called the Dwell Time Amendment, that was co-sponsored by Senators Webb and Hagel, failed by 4 votes to pass the filibuster to meet the filibuster number of 60. A week ago, Veterans for America was proud to stand with Congresswoman Ellen Tauscher on the House side when she introduced House Resolution 1052, which again calls for our service members to be given at least 1 year at home between deployments for those in the active duty and 3 years at home for those in the Guard and Reserve. Senator Webb will be taking up this measure in the Senate again, and this is something that will require a push. This is the kind of thing that we as citizens, when we allow our government to deploy our troops again without enough time at home, this knowingly compounds their wounds. And then we are complicit in that if we don't push our elected representatives to better care for these service members by implementing humane deployment policies. And again, Mental Health America has taken a leading role in helping to beef up what the capabilities in the VA as well as in the Department of Defense. But again, this is the kind of thing that when a unit comes home, and fortunately we do have the welcoming home ceremonies, but in addition to having things such as welcoming home ceremonies, we need to make sure that there are the services in place to help the service members readjust to life at home, or, again, as David mentioned, we will likely see a continued rise in the number of suicides amongst our troops, as well as the pressures being placed upon their families. So we call upon others to join us in making sure that we're tracking these variables and that we're holding our government to account